Well, perioperative means the whole range from anaesthetic, intraoperative to post-operative care.
I find it exciting. Things are always changing. There's always variables, and it's quite a challenging job.
I would say perioperative nursing is not something that you become comfortably expert in under about 3 years.
When patients have operations, they rarely remember the numerous faces of the theatre staff. This is the story of the perioperative or theatre nurse. They play an important role in modern health care and work tirelessly to provide safe care for their unconscious and semi-conscious patients. Without them, operations would not take place. Theatre nurses in Victoria are represented by the Victorian Perioperative Nurses Group, a professional nursing organisation who aim to improve the standard of perioperative nursing care and improve patient outcomes by supporting research.
The VPNG is the Victorian Perioperative Nurses Group, brought together by committed women who had an interest in perioperative nursing, who would represent perioperative nurses, be a forum for those who had issues of practice that had to be discussed and developed.
The VPNG hold a conference each year to promote, celebrate and provide education about perioperative nursing.
Okay, I'd like to tell you about the conference we've been holding this weekend for perioperative nursing. This is our annual state event and it's well attended. We have 300-400 nurses attend each year and 50-60 trade people. It's an educational conference, discuss current practice, current issues. The big one this year has been recruitment and retention.
Nursing is not just a job, it's a career. For many, nursing is their passion, their chance to make a difference to the quality of another person's life.
There is a worldwide shortage of nurses, and this is most obvious in theatre and intensive care. Professional nursing organisations realise that it is imperative to try different initiatives to recruit new people into nursing.
Some of the challenges and rewards of a career in nursing and show how you can make a difference by becoming a nurse.
Some of the topics we've been talking about are a bit hard for some people to get their heads around, looking at new ways of offering nursing, because nurses experience a great shortage. The average age of the perioperative nurse, it's the theatre nurse, is 47 years, and I wish I was still 47. So we're wondering about where that next breed of nurse is coming from, and we have to be thinking outside the square about that. Very confronting for some. So that was a really, really interesting session.
As well as discussing and debating nursing issues, Australia's professional nursing bodies utilise these conferences to promote themselves and their research materials.
Okay, the reason why the Royal College of Nursing is here at the Victorian Perioperative Conference is to actually profile the college and our role and function within Australian nursing. As the peak professional body in nursing, it's most important that we are present at this conference, as we see perioperative nurses as a very important part of nursing, and particularly from the national focus. Certainly the college has been involved in some very exciting projects nationally and internationally, and we just like the opportunity to be able to speak and profile the college here at this very important event. Well, we actually do have quite a lot of members, perioperative nurses in Victoria. One of the main things is that we're running some very good features on perioperative nursing. One particularly in our referee journal, The Collegian, is on work-related trauma, particularly with the horizontal violence that perioperative nurses face. So we're very committed to that. And also in our nursing review, it's a national nursing newspaper, we're running a series of articles on perioperative nursing.
But we attend the Perioperative Nurses Conference as a show of support for the perioperative nurses. And for those who choose to do agency work or casual work as an option to taking a permanent job, then we'd of course like them to do it through clinical nurse specialists.
The perioperative nurse is highly educated and often requires 6 years of study, including undergraduate and postgraduate qualifications.
The training would involve undertaking perioperative graduate certificate or graduate diploma, preferably a graduate diploma. In that way, the nurse gets the theory as well as the practice.
Despite many years of study, a job as a theatre nurse in a busy city hospital can be daunting for new nurses, as often the practice is difficult to learn from a textbook.
I think it was terrifying because of all the equipment. Patients were put to sleep. It was just a lot more daunting, I think, than on the ward.
However, with a structured support program and supportive colleagues, a career in perioperative nursing can be rewarding and challenging for young nurses who want to try something a bit different.
Get in there and go for it. It's great. Once you've got over the hurdles of being confident and learning the ropes, it's a fantastic career.